In this video, I'm going to explain about anti-helminthic drugs. From word itself, we can understand that these are the drugs which are used against helminthics. What are helminthics? These are parasites which are usually inward to our body into different system like GI tract, then blood vessels, lymph nodes, and etc., and which are tube-like structure. So these are the drugs which are used against this kind of worms, which will affect our body, which are the parasites. And there are two type of helminthic drugs. First one is worm. These are worms. So some drugs will help to kill, which will kill the worms, which is known as vermicides, and some drugs will help to expel the worms. These are known as vermifuge. Now coming to the classification of anti-helminthic drugs, the drugs which coming under the anti-helminthic drugs are mebendazole, albendazole, pyrandyl palmoate, praziquntil, diethyl carbamazepine, levamisole, tetramazole, niclosamide, and ivermectin. Out of this, mebendazole, albendazole, and diethyl carbamazepine citrate are important on exam point of view, which are frequently asked as in short notes. Pharmacology of mebendazole, albendazole, diethyl carbamazepine. Now coming to the different types of worms, just to understand what are the different worms and what are their classification. See, roundworms, example, worms in that roundworms are Ascaris lubricoids. Drug used are mebendazole, albendazole, and pyrandyl. Then hookworm, Ancylomata duodenea, mebendazole, albendazole, pyrandyl. Nectar americans, mebendazole, albendazole, pyrandyl. Threadworm, Endorobios vermicularis, mebendazole, albendazole, and pyrandyl. Stroglioid steracolaris, ivermectin. Then important one is filaria, Brucheria, Brankophti, and Brugia malay, which will cause filariasis or elephantiasis, in which the leg will grow or will swell like an elephant leg. That is known as filariasis, which is caused by Brucheria brankophti or Brugia malay. And treatment is by using diethyl carbamazepine, which are usually supplied to the home using ASHA workers in yearly basis. You know that filariasis, drug used for the filariasis. Guinea Drangulocus medinensis, metronidazole. Then tapeworm, Tinea saginata, Tinea solium, by using praziquantel. Then hydatid diseases like Echinococcus granule using albendazole. Now coming to the drug, first drug is mebendazole. Mebendazole and albendazole have same type of mechanism. What will happen? These drugs, mebendazole as well as albendazole, will bind to the microtubulin protein, or microtubular protein, which is known as tubulin, of susceptible worm with high affinity, and thereby it will inhibit its polymerization to form a tube-like structure. So by binding with microtubular protein, that is known as beta tubulin, which are more of susceptible worm, and it will prevent the polymerization to form a tube-like structure. It's a broad spectrum compound. Now what are the ADR? Compare with other drugs, these have less systemic toxicity, but some rare ADRs like diarrhea, nausea, abdominal pain, then which is contraindicated in pregnancy as well as children below 1 year, and allergic reactions like loss of hair, granulocytopenia have been reported with high dose. So that is mebendazole. Next one is albendazole. Mechanism is same as that of mebendazole. It will bind with the microtubular protein, which is known as beta tubulin, and it will inhibit the the polymerization of beta tubulin to form a tubulate structure. Now ADR, when compared with the mebendazole, ADR is rare, but in case of long therapy may cause headache, weakness, dizziness, alopecia, jaundice and neutropenia. Now uses used in different worms. We have discussed the name of worms in previous type of worms: ascaris, hookworm, enterobius and trichos, tapeworm and strong glycolodis, trichonisis, neurocyticirosis and cutaneous larva migration. So these are the uses of albendazole. Next one is diethyl carbamazepine. It is very effective against filariasis or elephantiasis caused by nematode like Wucheria branchofti. 90% of the filariasis is caused by Wucheria branchofti and Burkier Malay. Mechanism of action: this diethyl carbamazepine will make the parasite, Wucheria branchofti, susceptible to the destruction by host mechanism. Do not have any property to kill the microorganism, but it will make the parasite susceptible for the destruction by host defense mechanism. Now, what are the ADR? Parasite-induced reaction including fever, skin rashes, severe itching, chest pain, etc. Enlargement of lymph node, bronchospasm and fall in BP. And uses used in filariasis and topical eosinophilia. Then next one is praziquntil, which is effective against trematodes. Mechanism of action: it will rapidly taken up by susceptible worms and appear to act by causing leakage of intracellular calcium from their membrane. By this leakage of intracellular calcium from their membrane, it will produce a contraction and paralysis of trematodes or worms. So that is the main mechanism of praziquantel. And selective action of praziquantel on tapeworm and flicks may be depend on presence of specific variant calcium channels sensitive to praziquantel in this worm. Now, what are the ADR? It will produce dizziness, itching, skin rashes, bitter taste. A severe bitter taste may cause nausea as well as epigastric pain or abdominal pain, and which are used in tapeworm and Tinea saginata and Solium. So these are all about anti-helminthic drugs. Important drug is mebendazole, albendazole, diethyl carbamazepine and praziquantel.